Good afternoon. Thank you for joining today's webinar hosted by Message Media. My name is Sherry Hughes Smith and I am the moderator for today's webinar. Today's webinar is titled Patient Engagement in Healthcare, Leveraging SMS and Adopting to the New Normal. Before we begin today's webinar, a few housekeeping items. If you should have any problems looking or seeing the screen, seeing the presentation, or hearing the content within the presentation, please click onto the question panel within your GoToWebinar dashboard, and we'll try to help you on our end. If you should have any questions throughout the webinar, we ask that you also list your questions in the question panel within your GoToWebinar dashboard. Today's presenters are Doug Rubik, who is our president of the US and UK for Message Media, and Gabe Bueller, who is our subject matter expert as well here at Message Media. With that being said, I'll hand it over to Doug, and Doug will take it from here. Doug?
Thanks, Sherry. As Sherry just mentioned, I'm Doug Rubing. I lead the US and the UK business here for Message Media. And on behalf of Message Media, I wanted to say thank you to everybody for attending, and also wish everybody happy holidays, and also just looking forward to this new year. May your new year be great, and may you enjoy this holiday season with your families. A little bit about Message Media. We've been helping businesses engage with their customers for more than 20 years, including a strong focus in healthcare. We have Gabe Bueller on today, who's an expert in patient engagement and SMS communications, and he's got a lot to talk about there that I think you're going to find quite valuable. Just moving on to the next slide, if you don't mind. I wanted to just mention, just for 60 seconds here, about our areas of focus at Message Media. First off, we provide an extremely high level of expertise and support. That is something that our customers have found very valuable as they've implemented SMS and get customer engagement solutions in their business. And then ongoing support. We work shoulder to shoulder with healthcare systems to stand these systems up quickly and to get them operating right for their needs. The second thing is compliance, whether it be through HIPAA or through more subtle things that healthcare systems may not be necessarily aware of around carrier relations and how to keep the messages flowing, if you will. We make sure that messages are delivered, because these are critical communications, as you all are aware. And then last, our customers find a lot of value in products that are built right, whether it be through our native integrations with Epic, or with our other integrations across practice management, as well as our software as a service platform that our customers in healthcare use for example, scheduling and rostering, or other communications, either with patients or with their staff. We're proud to say that the consistent feedback from our customers is that they gain a lot of value from our solutions, and so that's part of what we're here to talk to you today about. So with that, I will turn it over to the expert, Gabe Bueller. Gabe, I'm happy to introduce you. Take it away.
Thanks, Doug. Yeah, welcome everybody. It's been a pretty interesting year, 2020, to say the least. It's been filled with challenges, lots of learnings, on basically a nonstop basis. But with those challenges, we've heard the phrase, the new normal, thrown around a lot. Is this going to be the new normal? What will the new normal look like? And so on and so forth. Specifically here at Message Media, and dealing with our healthcare provider partners through 2020, we really started to see two categories or partner profiles that emerged. There were those that had already implemented SMS or various different technologies, and were able to use those very quickly and efficiently with almost limitless use cases for patient engagement. And then there were also those which we supported that were kind of scrambling to implement some solution, a new solution, as it became more and more difficult to communicate with patients in a meaningful way. And our learnings as we help both categories of partners either optimize or early implement and quickly navigate those challenges was that the new normal will involve more contactless engagement, period. And we'll discuss different use cases we've supported shortly, but use cases such as waitlist queuing for pharmacies or notifications for parking lots as a waiting room, or COVID testing alerts and instructions, contact tracing notifications, even MyChart activation campaigns for those using Epic as an EMR, EHR. These use cases became imminently critical to patient communications. So in other words, using every technology possible to ensure engagement with your patient populations, to create meaningful healthcare interactions and promote better health outcomes. This really is the new normal as the world attempts to become more and more mobile and virtually focused. Throughout 2020, healthcare providers have felt a significant impact due to COVID. A study done by Health System Tracker concluded that total healthcare employment has dropped over 7.8% since the beginning of the pandemic. And primary care services have been impacted the greatest. Dental and physician services seeing drops of employment as high as 56%. Much of this was driven by the reduction in consumer spending associated to these services. When you combine that with various primary services having to temporarily close their offices due to local regulations, all of that led to significant layoffs or furloughs of primary care services staffing. That, however, that's not the new normal. Message Media works very closely with a lot of primary care service providers, as well as practice management software companies that support those primary care service providers. And the general feeling and belief is that they're already making the turnaround. They're beginning to bring their staff back. They're starting to see an increase in patient appointments now that regulations have begun to lift, as well as they've implemented cleaning measures and social distancing measures required to keep their patients safe. So really the next question for many of the providers that we support was, how do we communicate to our patients that we're back in business and we're fully operational? Justin Greneau from HealthBox said it best when he discussed a healthcare provider's level of technological implementation. And whether that's telehealth or SMS, those that have been and will continue to leverage all kinds of engagement tools and technology are really in the best position to not just adapt to a new normal, but really to help shape what that new normal looks like. So as we've helped to answer that question for the providers we work with, essentially, how do you communicate to your patient population that you're back in business? Here at Message Media, we were obviously biased. We have a biased opinion, but it's very true. SMS is a very inexpensive, reliable method of communication. And if you consider for a moment, a recent Pew Research Center survey found that 96% of Americans own a cell phone and 81% of those are smartphones. That's up from 35% less than 10 years ago, so it's really exponential growth. Additionally, the average American spends approximately 3 hours on their device a day, and they have it on them at all times. So by utilizing SMS as part of an omni-channel strategy, you really are accessing the best and fastest form of communication to get your patient's attention. It's why more than 90% of SMS messages are read in that first 90 seconds. And what's more, most of your patient engagement, the campaigns, and even bi-directional conversations, they can all be quickly and easily automated, yet still be personalized in a way that's meaningful for your patient. This is why SMS has been a critical element of many providers' COVID response strategy. It's simple, it's cost effective, and really my favorite, it's a force multiplier. Now, as I mentioned before, 2020 has meant quite a few use cases have become immediately critical, but Message Media has been working with healthcare providers for decades to provide guidance and best practices related to use case implementation. And whether that's utilizing our web-based platform or our industry-leading APIs and SDKs, or any one of our many partner integrations, healthcare providers have a lot of out-of-the-box use cases that make setup and implementation fast, easy, very effective. Some of these use cases have clear metrics, clear ROI numbers associated to them. For instance, if you were to look at appointment reminders, staff rostering, or even billing notifications, these all have demonstrable success behind them. It may be reducing no-shows by 45% in the case of appointment reminders, or decreasing administrative costs by more than 20% when using SMS for staff rostering, or even increasing revenues by 30% when using SMS for billing notifications. Those are not small numbers. But even more than that, message media has helped many providers implement use cases where the ROI may not be as clear, because ultimately patient engagement and the improvement of health outcomes is what really matters. So when you look at things like prescription medication reminders that provide a quick alert to a patient, letting them know it's time to take your medication, or health and well-being surveys to keep a virtual finger on the pulse of your patients. Things like that, it's hard to put a number to, right? Emergency notifications, or informing your patient population of promotions that may be upcoming to help fill empty calendar slots. All of these have been very valuable and successful campaigns that our healthcare provider partners have said they really don't know what they would do without SMS in those instances. As I mentioned though, many of those use cases have provided clear metrics and ROI. One use case that has very clear benefits using SMS, especially compared to other forms of media in an omni-channel strategy, is appointment reminders and alerts. One hospital estimated that they sometimes experience no-shows of 60%, all prior to implementing SMS, of course. So they ran a trial, simple two-step campaign, sending a 5-day reminder and one that was 24 hours out. And within that 2-month period, a 2-month trial, they experienced a drop of almost 45% in no-shows. It was a massive improvement in a very, very short amount of time. So applying that to your organization, you can imagine the admin savings related to personnel not having to reach out to patients, or the added revenue by ensuring that appointments are attended. It's pretty easy to see how that one use case can really impact your operations. But those kinds of results, they're not really a surprise for us. We see that pretty consistently with the implementation of appointment reminders via SMS. Ultimately, it's because compared to email, patients open an SMS message that's sent to them 98% of the time, almost 100%. And remember, they're on their phone more than 3 hours a day on average. Now, email typically experiences an open rate of about 22%. As well, your patients will typically read their SMS reminder within 3 minutes. You compare that to 48 hours for emails, and I mean, by that time, the appointment may have already passed. And finally, the click-through rate, it's almost 6 times more effective than email. That kind of patient engagement is why we've further worked with organizations to optimize that process, more than just a 5-day and a 24 hours before. Some expanding that to an 8-day, a 3-day, as well as a day of reminder cadence with customizations, allowing their patients to cancel or reschedule based on keyword automations, or even a link that sends them to their patient portal to access their patient information and manage their appointments. Especially that last one, the link, that's been very, very helpful in increasing MyChart activations for our Epic customers, or even increasing attendance patient account activations for their desktop or mobile apps. It's very interactive. But with all that said, we understand that every healthcare provider is at a different stage of their technological implementation lifecycle. That's why our provider partners and practice management software partners all have a number of choices to begin sending messages and engaging with their patients. Some providers choose to dedicate development resources to the project, quickly getting access to our industry-leading APIs and SDKs, and they might build out a messaging solution that's custom fit for them. We're happy to support them through that. Others will utilize Message Media's web-based platform to engage with their patients. Account setup is lightning fast, and with a huge amount of pre-built products, a provider can be sending messages within a few minutes. Finally, many of our healthcare providers will utilize us through one of our integrated partners. In the healthcare space, for instance, our integration with Epic Systems, EMR, EHR, offers Epic customers a fast and easy way to set up SMS through MyChart tickler campaigns, or directly out of a handful of Epic's mini modules. But no matter what method a healthcare provider chooses, Message Media is different than other messaging companies in that we have dedicated support 24/7 and project management available to all of our customers. As simple as it seems, SMS can be a very complex and difficult landscape to navigate. And we've had providers that'll come through and contact us on a Sunday afternoon and say they have an emergency notification that has to go out. And our support and project management team can get those kinds of things done for them. I mean, every step of the way, there are technical, regulatory, and many compliance considerations that you have to take in. the SMS partner you choose is very important to help with that process and ensure success. So at Message Media, we're SMS experts, right? We've been supporting businesses for more than 20 years. We take a lot of pride in supporting all of our partners and helping to make them SMS experts as well. So with that, we're happy to field a few questions if there are any out there.
Okay, so if you have any questions, please list them in the GoToWebinar dashboard, and we'll be more than happy to read them aloud. Hang on just a second, I'm having some difficulties on my end. Sorry about this, there is a delay on my side. Okay, the first question we have for you, Gabe, is what kind of examples do you have related to the staff roster or internal communications?
Yeah, absolutely. So this has been one of the largest use cases for a lot of our healthcare partners. One of the most impactful examples, we worked with a healthcare provider that at the time they were using a temp staff agency to fill open shifts. And we had a bit of a back and forth to understand what their needs were and everything. And we essentially created a texting pool with all of their staff to where any openings that came open, it would blast out a text to everybody who could potentially be on call for that day. And then the first person to respond back would fill that, that opening. And what it ultimately came down to was they were able to get rid of the need for the temp staffing agency, which shockingly enough saved them over $400,000 a year in budgetary considerations. So that one use case for staff rostering was incredibly impactful. Or for internal communications, using it for on-call staff, depending on where somebody might be in the hospital itself. A nurse could blast out an SMS if a specific patient needs something, or if there's a code blue, and the SMS would go out to everybody who's on call, and the nearest person could respond. So just a couple of examples of how it can save on admin work, and sometimes even not having to enlist the services of like a temp staffing agency.
Okay, great. Is Message Media or SMS HIPAA compliant future for SMS in healthcare?
Yeah, so fantastic question. This is always a fun question to respond to, but you know, HIPAA can sometimes be a bit of a nebulous legislation. And while Message Media would never really suggest that all potential SMS messaging is HIPAA compliant, quote unquote, we always work closely with basically as advisors for our healthcare providers to ensure their compliance. And we've come to understand there are really two primary ways that we help them do that. First, we work strategically with them early on to avoid sending any PHI via SMS. You can typically accomplish this by only containing like the date and the time of an appointment, or simply providing a confirmation that their message or information was received, but avoiding any PHI. The second is through gated links. So if you're trying to get sensitive, confidential information to a patient in the fastest way possible, SMS is certainly the way to do that, through a link that routes them to their patient portal. Then you can verify the identity, you can authenticate the user before displaying the confidential information itself.
Okay. What's the best place to get started?
Oh man, yeah. So that's definitely it's going to be unique to each provider. I'll say it that way. But from the Message Media side of things, barriers of entry are very, very low. We would typically set up a quick chat with a healthcare provider, with our solutions team, to fully understand their current state and what their needs are, and build out a quick roadmap that's specific to you. But from a use case perspective, a lot of what we discussed earlier, appointment reminders is one of the best ways to quickly see value and begin engaging with your patients.
And how do we get started, or how do we start getting mobile numbers?
Sure. So there's a lot of kind of early ways to do that. A lot of our healthcare providers have, you know, they've set up a call to action or an intake form as they're setting up their, for instance, like a MyChart account or something like that. Other low technology ways is almost like a point of purchase or a point of interaction, point of check-in messaging. So a simple sign that says, you know, text reminder or text check-in to 112233, for instance, to receive reminders when your prescription is ready. And that acts as the actual opt-in and consent. That's one of the fastest and easiest ways, especially related to certain use cases, to get patients on the roll, to get the mobile number in there, and to be able to begin engaging with them.
How has SMS been used for contact tracing in response to COVID-19?
Few different ways. Probably the most common way that that we've seen it is a means to alert the individual that a representative will be contacting them, because typically the outreach for contact tracing, you need to get that individual on the phone and kind of do a retrospective on where they've been and who they've been in contact with. We found that by utilizing SMS, the likelihood of that individual picking up the phone and actually engaging in that survey grew exponentially. And that's probably the most common way that we saw it, is to notify the individual that a representative would be contacting them shortly to perform that specific survey, as well as site notifications. So the other common thing is notifications both to test takers or to personnel for directions or confirmation of the appointment that their scheduled COVID test is upcoming.
Mm-hmm. Okay. Do we have any other questions today? Remember, you can list your question in the question section within the GoToWebinar control panel. All right. That looks like that's our last question for today.
Yep. Not a problem. Thank you, everybody, so much for the questions. And be sure to sign up for our future healthcare webinar series. We'll be kind of doing more of a deep dive into partner integrations that we currently have. So if you have certain technical questions or things like that, we'll be addressing that at that time, as well as really helping our healthcare partners to understand the SMS landscape. As I mentioned earlier, it can be a little complex and overwhelming, and we really want to be that partner that's there to help educate and make you SMS experts. So when it comes to things like sender IDs, dedicated short codes, or toll-free numbers, what's best for your organization? How do you roll that out across the entire organization, as well as changes to be aware of in 2020 and things like this. So make sure to register for upcoming webinars, and we'll be sure to communicate when those come up.
Absolutely. We'll be sending out the schedule for upcoming webinars at the beginning of this year. I also want to let you all know that we will be forwarding the link to this webinar to you within 24 hours so that you can share it with your colleagues and friends. We will also be sending out a survey to you to ask how we did, and also look at other topics that you would like us to consider as we look at the 2021 webinar calendar. So on behalf of Message Media, we do thank you all for attending today, and we do wish you a very happy holidays.